A new effort to reform the health care system is gaining steam in the Senate. The Graham-Cassidy bill would repeal the infrastructure of the Affordable Care Act, but it would leave the taxes in place and funnel that revenue towards the states. The White House backs the bill, so does the Speaker of the House, and the bill's sponsor, Lindsey Graham, appears optimistic.
We're going to get 50 Republican votes, and I make a prediction. There are going to be a lot of Democrats struggling with a no vote, because at least eight of them, their states do far better than Obamacare in terms of funding, and they have more control over the money, and that's going to be a hard no.
Andrew Friedman is the principal at the Washington Update, and he joins us now to discuss this latest effort. Good to see you again, Andrew. Welcome back.
Hi, Sue. How are you?
I'm good. How do you handicap the odds on this? Because what we're hearing from Republican leaders is that they kind of feel like this is it, that this is their last best bet to getting health care reform through.
Well, it's probably their last bet. I'll agree with that. The concern many have expressed about the bill, and as Senator Graham noted, some states do better under this bill. They get more money from the federal government for their health care system than they do now, or they would get more. But what that does is it's taking money away from states that expanded Medicaid and provided free insurance to all lower-income people. They're left holding the bag. They don't get as much money from the federal government, which means many of the constituents and residents in those states are going to lose insurance that they currently have under the ACA. And I think that will be a problem for senators and governors in those states.
Do you think that they have the votes? I mean, Senator Graham seemed to think they do, but as you know, it always comes down to the wire.
It sure does. Well, first of all, they're not going to get Democratic votes. That's hyperbole. The question is, will the Republicans that held out on the prior attempt to fix the ACA support this attempt? We don't know, and one problem that we are facing is we're not going to have an estimate from the Congressional Budget Office as to how many people lose insurance and how high premiums would go under this legislation. So everybody's going to be shooting blind. My guess is, and we'll have to see when it comes right down to it, I think that enough Republicans that did not support the prior attempt are probably not going to support this attempt. They're worried about constituents losing insurance who are used to having it.
You know, it says here that it would restructure the ACA waivers to let states more easily drop certain insurance rules. What rules would that refer to, and is that another contentious piece of the plan or not?
Well, it could be. What it would allow the states to do, as I understand it, is to determine what types of diseases or maladies that the insurance is required to cover, which means that states could decide that insurance purchased might not have to cover, pick a disease or pick a condition. And that means, again, people could be left holding the bag in the sense that they have to pay for their own medical procedures. And that, too, means people may be left with unexpectedly bad results.
We will see. Andrew, good to see you again. Thanks for joining us.
Thanks for having me.
Andrew Friedman with the Washington Update.